Bismillahirrahmanirrahim. As-salatu wassalamu ala rasulil kareem. Welcome to the second session of the Health Expert Talks. As you will know, we launched this series last month, the idea being that we wanted this to address unmet health needs of the community. And we're delighted to present the second session in this series and on a very important topic that is of relevance not only to the Muslim community, the Asian community, but to all segments of society. And this is the topic of weight management. So as you know, there's an obesity epidemic in the Western world. So this is and it affects all communities. And so this is a very important topic to be addressing. And we'd like to, on behalf of the mosque management, I would like to welcome and thank our speaker, Junaid Muhammad, for today, who's eminently qualified to be teaching us about this topic today, mashallah. So Junaid is a highly qualified pharmacist, so he's a senior clinical pharmacist, he's an independent prescriber, mashallah, and he has an expertise in diabetes and weight loss. And what is more than that, what sets him apart from most of the pharmacist colleagues is that he has a qualification in psychology as well. So he can take, mashallah, a holistic mind-body view of the problem. And inshallah, I'm sure the insights that we'll kindly provide today will be of benefit not just for ourselves, but something to impart to our children, our elders, even our patients for those who are in the clinical area. But just one of our pediatric consultants who comes to the masjid was talking to me the other day about the problem of childhood obesity. You know, such a problem. So this is a problem that affects all ages, and it's a very important topic. And really delighted that Brother Junaid has made time to speak to us about this. There will be time for questions afterwards, and after we will circulate a feedback form on WhatsApp. So please do give us your feedback. That's very important.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. First and foremost, I'd like to thank Allah subhanahu wa ta'ala and send salutations upon our beloved Nabi sallallahu alayhi wa sallam. I personally thank the management here for providing this opportunity and facilitating the talk, and Dr. Nasir Mirza, who contacted me to try and request me to do this. And also Jazakallah to everybody who's attended, brothers and sisters, Jazakallah. So the topic has been mentioned. The title is The Right Way to Lose Weight. Now, like brother mentioned, that it's a very hot topic at the moment. This side. Hopefully that will be better.
I think his phone will be deflecting.
Okay. So, like was mentioned, it's a very hot topic at the moment. Now, like Imam Sahib also mentioned, obviously Ramadan is coming. In general, as Muslims, we aspire to be healthy individuals, eat healthily, be healthy, be the best Muslims we can. But also, we'll allude to this, but also there's a big topic at the moment regarding about weight loss medication. It's in the media, people are talking about it, and as Muslims we should be in the know. So it was requested from me to talk about this as well, so that inshallah we can be ahead of the game and understand what this is, and we can alleviate any misconceptions that there might be, because there's a lot going out in the media as well about weight loss medication. So inshallah we'll speak about this as well, inshallah. So, just a bit of a background about myself. I studied pharmacy in De Montfort University, Leicester. After that, I did my pre-registration year in Boots Pharmacy, so I was a community pharmacist. And then after that, I left community pharmacy to do a clinical role in Warrington Hospital. So I worked a couple of years in Warrington Hospital. And then I went on to do a clinical role in a GP practice, in Cornerstone Practice in Blackburn. I still work there at the moment. So within this clinical role, I built a specialism, like was mentioned, in diabetes and obesity. But also another qualification is about in mental health, psychiatric therapeutics. So like it was mentioned, that these chronic conditions they coexist, yeah, and how they interplay is very important, and it has a big impact. So like I mentioned, I still practice in Cornerstone Practice and the NHS, and also do a private clinic, On-Call Doctors, which is based in Blackpool, and the private clinic is for weight loss. So it's a medical weight loss clinic. Although it's based in Blackpool, it's a remote clinic, so it provides opportunities for people in various locations to be able to access that clinic and be able to provide support for them. So the agenda for today, we're going to be speaking about obesity. What is obesity? Yeah, about weight gain. Set the scene about what that actually is, why it happens, what's the health concerns with obesity and weight gain, and how that's impacting not only the wider community in the UK, but also our own local community. Yeah, so what does that mean for us? I would like to put into perspective in terms of our deen in Islam, what is the guidance in terms of being healthy and being a healthy individual. So we'll speak about what the Quran tells us, what is mentioned in the Hadith as well, and looking at the Sunnah of our beloved Nabi sallallahu alaihi wasallam. And then we'll go on to talk about diet advice, healthy lifestyle advice, exercise, and we'll finish off by talking about, like I mentioned, about the weight loss medications and what that means and how they work, and the relevance of that in weight loss. So, weight gain. Why does it happen? Weight gain or obesity is a complex area. Yeah. So naturally, when we think about weight gain, or we think about somebody who's gaining weight, we think, oh, he's just eating the wrong things, he's being lazy, or something like this. There's all these stereotypical things that we are thinking, but reality, it isn't that. Yeah? It's actually a lot more complex than this. And there's a lot more things going on that might be contributing to that individual's purpose of increasing weight. Okay, so sometimes we might see that there's an individual, we might be with them in their company, they don't eat that much. They might be eating the same as us, we have the same diet, but they're increasing in weight, and you might be staying the same, or vice versa. What is the reason for this? What is at play? So there's multiple factors that can affect this. Number one is genetics. Yeah, our genetic makeup. Some people have a genetic makeup that more inclines them to be to gain weight compared to somebody else who doesn't have that same genetic makeup. Yeah. So likewise, sometimes you see this in certain families. Sometimes can get a family, for example, who are more inclined, and everybody in that family is quite in a higher weight, and you're thinking, well, what's going on here? Are they eating a lot in their house, or is their diet not correct, etc.? But no, it might not be a case that that there's something wrong with their diet, etc. But it might be a case that the genetics in that family are that they're more inclined to have a higher weight. But that doesn't mean that they're lumbered with weight or they can't lose weight. It just means that their journey for weight loss is different to somebody who doesn't have the same genetic makeup. Likewise, there's certain hormones and health conditions that contribute to high weight. So for example, we've got the likes of insulin, cortisol, GLP-1, which we're going to talk about. All of these hormones that are naturally found in our body, having different levels of these hormones is going to affect how much weight we put on, or whether we're high weight or low weight. Likewise, there's certain health conditions. For example, it might be diabetes, it might be in the menopause, it might be thyroid related, that also contribute to weight gain. Okay, so this is another factor that we think about when we're thinking about weight gain. Likewise, there's medications that we use to treat these conditions that can also cause weight. So there's certain medications, for example, that we use in diabetes that promote weight. Yeah, there's certain mental health medications, for example, like antipsychotics, for example, that also promote weight gain. Yeah, so there's multiple factors of why there's health condition reasons why somebody might increase in weight. Now, obviously, eating habits is we expect that. That's eating habits is obviously a big factor of why somebody would increase in weight and why we increase in weight. Now, if we look at the current situation, you could say in the current trends of eating, you could you say even from 10, 15 years ago, 20 years ago, now we have the promotion of fast foods, easily readable, very easy to get food, fast foods, processed foods. You know, we've got the likes of Uber Eats, etc. All of this is contributing to an epidemic that it was mentioned of obesity. So the choices that we make in terms of our eating, and also I'll go on to talk about. So it mentions that about environment and availability of food. So if you look at our lifestyle now, for example, like it was mentioned, the readily accessibility of fast foods, for example, if we just go down the road, how many takeaways and restaurants do we have available? These were not here probably maybe 15, 20 years ago. Likewise, our lifestyle. If we look at our elders, for example, who first came into this country, maybe in the 60s, 70s, etc., their general majority of their occupation would have been a laboursome work, something where they were working in a cotton mill, in a factory, utilizing their muscles, utilizing their body for work. Alhamdulillah, yes, we've changed from that and we're doing desk jobs, but that could be a negative as well. Some of us are sitting at a desk 7, 8, 9 hours of the day. Yeah, we're not moving as much. We're not utilizing those muscles. Likewise, some of us are working from home. Yeah, we go from the bed to the desk, back to the bed again. So there's not much movement happening. So in reality, all of these environmental factors, social factors, are having a big part of contributing to our community increasing in weight. Stress and sleep is also another thing. Stress, anxiety. There's certain hormones when we're stressed and we're anxious that promote weight gain. Likewise, when we speak to some people will have this notion of when they're stressed, they comfort eat. Yeah, they do things, they change their behaviors to make themselves feel better. And food is something that we have a relationship with food in general. We all have a relationship with food. And in general, we enjoy food. And sometimes if we have anxiety or stress, or etc., we might resort to food. And this is why it can be seen sometimes there's a correlation between mental health concerns and weight gain. And likewise with sleep. So sleeping, the whole process of sleeping is very important for our body. When we're asleep, our body is going through this process of, especially when it comes to food and digestion and utilizing glucose, etc. So we need the process of sleep. Now, if we're somebody who suffers from insomnia, for example, and we're getting less sleep, then we potentially might not be, the body's not being able to recoup and utilize that energy appropriately. Likewise, if we sleep too much, that can also have an effect on weight gain. So there's multiple factors. The thing is that we don't want to be judgmental, stereotypical of somebody who might be of high weight, because there's multiple factors that are at play, and we don't know what's contributing there. So what are the health concerns with obesity? So one thing, when you're high increase in weight, the first thing we think is appearance. Yeah, we want to lose weight to look better, but reality is that is secondary to actually our health. The most important thing is the health concerns that come with obesity. Yeah? So when you have excess of weight, the impact that has on every organ in the body is huge. So it contributes to potentially to a lot of diseases. And so the one that we will be most familiar with, especially in our community, is type 2 diabetes. So there's definitely a link. There's clear studies there that show that being high in weight increases your chances of having diabetes. There's lots of doctors in the room, who got far more experience than I have, but I'm sure you could probably comment that before we used to think of diabetes as something that type 2 diabetes somebody gets in their 50s or their 60s. Yeah. Now we're seeing the more prevalence of diabetes in 30s and 50s. Why? Well, obesity is probably a big factor in this, the way that we're eating and thinking. So there's a direct link between this. Now, obviously, we know somebody, we've all got family members, etc., who've got diabetes. What is the implications of that diabetes on that individual? How is it changing their life? Yeah, what impact is it having? The restrictions that they're having on their eating, the restrictions on the things that they can do and where they potentially can go as well if they need medication, and the health concerns that they have, the worrying concern. Likewise, high blood pressure, again, being high in weight has a direct effect on blood pressure, and cholesterol as well. So again, you know, the foods, there's certain foods that we eat, especially those that are very high in fats, have direct impact on cholesterol. Now, if we put these three things together, diabetes, high blood pressure, cholesterol, which, let's be honest, is probably very common within our population, yeah, then one of the main concerns is that we're going to have issues with our heart. Yeah, so heart disease, having risks of heart attacks and strokes, and this is what we want to try to avoid. And this is why we're having talks like this in our masjid, so that we can increase the awareness of the impact weight has, so that we can protect our heart and be healthy, and inevitably want to reduce our risks of having heart attacks and strokes. Yeah. Obviously, if you're increasing in weight, then naturally we see that it has an impact on our breathing. Yeah. If you observe somebody who's obese and I think you ask them to climb a flight of stairs, whatever, when they get to the top, they might be out of breath. Yeah. Or if we've got high in weight, we're going out with the kids, we're playing with our children, whatever. We're trying to keep up with them, whatever. Is making us go out of breath. So we're more likely to be out of breath because we are what our body has to go through to move and mobilize with the excess weight takes more strain on the body. And there's also something called sleep apnea, which basically this is obstruction of the airway. Yeah, in a very simple terms, obstruction of the airway when we're sleeping. Anybody who's got sleep apnea will know, and we might have family members as well. But it really disrupts somebody's sleep, and usually this is mainly a lot of the time is related to obesity and high in weight, increasing weight. So again, it's not something. And then we've got things like joint pain, back pain. Obviously, if we're carrying this excess weight, what impact does that have on our body? Our joints, our back will be feeling it. And because now we're seeing obesity in a younger age group, so say we might see obesity in the age 20, 30, what about when these individuals get to 50, 60, you know, things like arthritis is going to have a part to play, because the body is being burdened for many years with that extra weight, and is becoming very difficult. So in general, you know, you're talking reduced mobility, lack of energy levels, low stamina. In reality, the impact of the quality of life is massive. You know, there's the diseases, but in general, the quality of life is going to be impaired if we are carrying that excess weight. So, how common is obesity in the UK? So, there's some just very simple statistics here that it says 1 in 4 adults are living with obesity in the UK. Now, this is somebody. Obesity is defined. We must have heard of this term called BMI. Yeah, this is when we check somebody's weight and they check their height, and we plot where this person is in terms of their body mass index. Okay, so this is looking at 1 in 4 people will have a BMI of over 30 in the UK. Likewise, 2 in 3 people, UK adults, are overweight or obese. So this is a BMI of between 25 or 30. So these are very prevalent numbers. If you look in our masjid, yeah, and we look on this on Jummah Day, how many people there are here. If you're saying 1 in 4, that's a lot of people that is being affected. But unfortunately, like it was alluded to before as well in the introduction, about what impact is this having on our youth, on our children. So it mentions here a stat that 1 in 5 children are overweight or obese by the end of primary school. And we know that if a child has obesity, is struggling with obesity from a young age, the impact that's going to have on their from their early adulthood and adulthood is going to be it's a huge impact. The difficulty for them to then lose that weight, the difficulty for them that they're going to have the high risk they're going to have for health concerns, etc., and also the stigma, the social circles, etc. It will have a massive impact. So really, it's very important that we ensure that we're instilling healthy habits. Yeah, we're instilling healthy habits within our youth, and making sure that us as parents are portraying the right message to our youngsters. So it was mentioned earlier as well about obesity rates have steadily increased over the last 20 to 30 years. So we're seeing this increasing epidemic is becoming more of an issue. Hence why we're having talks like this, and inshallah we can do this in other masjids as well to raise the awareness, inshallah. Another thing to mention about this higher risk in certain communities and certain ethnic minority communities. So our community as a South Asian background would come under this category as well. There's higher prevalence would be in our community. Hence why it's important that we raise the awareness, because there is data to show that in the South Asian community, we've got higher rates of obesity. Likewise, we've got higher rates of diabetes, etc. And they all sit hand in hand. So before I go on to talk about what the UK guidelines mention, what, about healthy lifestyle, etc., I wanted to turn our attention to what is to our deen and what Allah subhanahu wa ta'ala is guiding, mentioning to us, and what is our beloved Nabi sallallahu alayhi wasallam, what is his way that shows us how to be a healthy Muslim. So first of all, there's an ayat of the Quran that mentions, "O humanity, eat what is lawful and good on the earth." Yeah. So note the terms halal, lawful, and tayyib, good and pure. So it's mentioning not just to eat halal, but also to eat good food. Yeah. That the choices that we make, yeah, in terms of what food that we are eating, is not just about consuming halal. That we have the choice, and we make those choices to eat, and it's been commanded for us to eat good and pure food, because we know that there's the English saying, "You are what you eat." Yeah, what you put inside is what you're going to be. Yeah, if we eat pure, good, halal food, then inshallah this will be a means of us also doing good, pure, halal actions as well, and being able to portray ourselves and be able to do ibadah in the correct form, and the impact that you could say the foods that you could class as unhealthy, processed foods, etc., the impact that has on us and our iman is also a factor to play here. Yeah, we've all we've all been there. We've had gone out to eat and had a very naughty meal. Lots of fats, etc. The difficulty in waking up for Fajr the next morning or the Tahajjud on that night is much more difficult than if we have taken precaution and eaten well the night before. And we've all been there, we've all experienced it. And obviously I'm just alluding to this, but our ulama, etc., can go further into this and explain this to us. It mentions about 4 places where there is command to eat halal. There's about 4 places where there's command to eat halal, all 4 accompanied with the word tayyib. So this is just stressing that importance. Likewise, this ayah of the Quran says, "Eat and drink, but do not be extravagant." God does not like extravagant people. Now, this could be, I got this ayah and I got some guidance from Ali when I was putting this together. So he mentions that extravagance could be also determined, it could be interpreted as waste as well. But if we look, and I'll reflect on myself, my own family and our habits, etc., when we're at home, we look at the dasarkhan, the table, the food on the table, that we've always got excess. Am I right? That's the common now. We've got excess. We've always got food left over. We've always got thingy. When we go out to eat, we want to order this, starters, main meals. Sometimes we know we're not even going to finish it, but we order it. This is become the common trend. Becoming the common trend. This could be, I would say, this is my interpretation of this, is that this could be classed as extravagance. So Allah subhanahu wa ta'ala, He likes simplicity, and as a Muslim we should be simple. So we can take lessons from this in terms of our diet as well and what impact this is having on us. Also, it'll be good, I wanted to allude to the hadith perspective. So the believer eats, it's said to the nearest effect that the believer eats in one intestine, but the infidel eats in 7, reported by Bukhari and Muslim. Now again, the word intestine could be interpreted as stomach. Now this is alluding to moderation, again, in eating versus excess. Yeah, so illustrating that believers consume only what's necessary for sustenance and showing contentment. So contentment is a big thing here as well, you know, that as a Muslim, we're content with our provision, with what we have given, and not wanting more and more. And we eat, reality is that we should be, and I mentioned it before, that reality is that we should be eating sufficient for us to have enough energy to do our ibadah, enough energy to do the work of Allah, to look after our family members, etc. And if we go in excess of this, it's gonna have a negative impact, isn't it, on our ibadah, on our ability to do dini activities, on our ability to spend time with our family. And we've all been there. We've all experienced this. So a believer who is strong and healthy is better and dearer to Allah than the weak believer. But there is goodness in both of them, reported by Muslim. Again, this is about us being a strong Muslim, so that we can do the work of Allah and perfect our iman and our ibadah. Man does not fill a container worse than his stomach. A few morsels that keep his back upright are sufficient for him. But if he must, then 1/3 for food, 1/3 for drink, and 1/3 for his breathing. We've all heard this hadith again and again. Me included. I don't know how many of us are able to. It's very. When I look at this, I think it's very hard to picture 1/3, 1/3, 1/3, isn't it? When I see food and I've got a burger and a pizza and chips, I just want to get it all. I want to get it all inside. I'm not thinking about thirds here. But reality is, we repeat these hadiths for our own sake, because we repeat them so that inshallah, we can take lessons from them again and again. I think it's mentioned many times in other places as well about the stomach. What we put into our stomach has a massive impact on our body in general, and our iman and our ability to perform as a Muslim. And I think the final bit about the 1/3 is that when we get up from eating, or when we're eating, it shouldn't feel so much that, oh, I can't even move, I can't even get up. That means, I think that's a clear sign for us that we've gone too far. And I think if we keep in the habit of this, then it'll become easier for us. One thing I wanted to, time didn't allow me to do so, but I also wanted to go into a little bit about the prophetic, the sunnah of Nabi Sallallahu Alaihi Wasallam in terms of how he ate. That would be a beautiful thing for us to allude to, because reality is that we know that there's nothing that our beloved Nabi Sallallahu Alaihi Wasallam did that wasn't commanded from Allah, that wasn't guidance from Allah subhanahu wa ta'ala. So if we want a role model, if we want to see what is the best way to eat, etc., then there's no better way than looking at the life of our beloved Nabi sallallahu alaihi wasallam, what he ate, how he ate it, the ingredients that he was using. And reality is that everything that our Nabi sallallahu alaihi wasallam ate as well, there was a purpose behind it, you know. When he used to eat dates and eat, for example, with the cucumber after it, whatever, the cooling effect, there's a purpose behind it. We look at black seed, for example. The amount of studies that are out there now about black seed and the benefits, etc. But we knew about this, as Muslims, we've known about this for so long. So, reality, the point I wanted to make here, that also we're going to move on now to talk about diet and exercise and etc. But I wanted to always say that first and foremost, we look as a role model to our role models for our Nabi sallallahu alaihi wasallam. So, when we're looking at diet advice for healthy weight loss, yeah, so a lot of it is focusing on quality and not just quantity. Okay. I don't believe in my clinics when I've got patients where I'm supporting them to lose weight, etc. I never advise strict diet plans. You know, these extreme diets where you only eat certain types of food and miss it. So reality is it's the simple things that we can do that we can have sustained changes, change our behaviors over time. We all know. Reality is we all know what are the healthy options and what not, what I should be doing or what I shouldn't be doing. But it's about putting those into perspective. And sometimes we just need that encouragement and that push. But it's all about consistency. So I mentioned before as well, eating about whole, unprocessed foods. A lot of the foods are easily accessible, the quick foods, etc., all processed foods. Yeah? All these foods that are that we see in packaging and etc. The things that when we're really busy, we grab a packet of crisp, we grab a ready meal, we grab this, we grab that. These are foods that are, or a lot of them are processed. Now, what goes in behind these things to preserve them, etc. This, if we went into this, is a whole different field, and we realize the harms that could potentially be coming to our body. So, reality is that we come from. Majority of us here come from a South Asian background, etc. What's going to be at home? Yeah. Reality is that the majority of us in our houses, there's going to be chapati, there's going to be roti, there's going to be rice, there's going to be some sort of salan, there's going to be some sort of protein, there's going to be some vegetables. How do we incorporate that, yeah, in a healthy manner? Yeah, and that's what we should be thinking about, because we don't want to. We can't. I'm not going to say, and I say to, I'm not going to have. For example, a 60, 70-year-old Pakistani uncle, whoever, that's come to me and say, you know what, eat salad and eat this, eat that. He's going to say, how am I going to follow that, right? So we all, even me, you know, majority of the week, I need my roti, I need my thingy, right? So how are we going to incorporate that and still be healthy? Yeah, and that's what this is all about. So this is what we move on to the balance plate. Yeah, so in general, we should see that on our plate, yeah, that we have a good amount of vegetables on the plate, yeah. Obviously, in guidelines they say 5, you're 5 a day, fruits and vegetables, etc. But the reality is that in a lot of our houses, whatever, we want the protein, yeah, we want the rice, we want the chapati, but we don't want the veg, yeah. And unfortunately, because we're not in the habit of it, our children are not becoming in the habit of it, and this is a scary time because they're coming away from eating these and. We go down the road. We're very fortunate, we've got shops and supermarkets and etc. here that are bringing very fresh foods from all over the world, whatever, but we're not utilizing them. Yeah, so we incorporate this into our diet and our obviously, I'm sure we've got some good chefs over here who do some good cooking at home as well. But I'm sure our sisters who are listening as well, that when they're preparing the food at home, etc., we think about healthy ways of producing for the family and incorporating vegetables, etc. in the food. So our plate should look like at least a half of it is vegetables, some protein, and some carbohydrates. Now it mentions here about protein at meals. Now proteins in general keep you fuller for longer. Yeah. So there's certain ones that are mentioned here about lentils, chana, kidney beans, fish, chicken, paneer. These are all things that might be found in our Asian diets. But reality is, if we incorporate small amounts of these, it means that we're not eating as much of the carbohydrates of the breads, the pastas, the rice, etc. So we can have more of balance, and we're not feeling the need to eat again, maybe after an hour or so, because we're feeling full and content. Obviously, the main thing here is mentioned about reducing the high-calorie foods, yeah? Reducing the fried foods, the sweets, the desserts, the sugary drinks. We know, it's not saying that don't enjoy yourself. Enjoy yourself, but in moderation, yeah? There used to be, alhamdulillah, in our community, you could say that we have the means nowadays to eat more, order from outside, yeah, order food, etc. It's become more of a thing. If we look at our elders, etc., before they would think twice about it, and many times about going out to eat at a restaurant, etc. So times are changing, yeah. But what access we're giving, especially to our youth, to our children, etc. So promote, bringing in takeaway into the house 2-3 times a week. It's going to have a massive impact. And what message are we giving to our next generation? And if anything, with the likes of Uber Eats and all this kind of stuff, the situation is only going to get worse, because the reality is you can sit at home on the sofa and all these foods from this, you don't even have to go there to get it anymore. At least you used to burn some calories in walking there and coming back. Now you don't even burn those calories anymore. So reality is that, and it was mentioned about Ramadan earlier as well. Yeah? Ramadan is a beautiful time for us to be able to potentially lose weight as well. Reality is that if we have yeah, a lot of people say, "Oh, I put on loads of weight in Ramadan." And we're talking in summer as well, when he was 16 hours fast, etc. I'm thinking, scratching my head, thinking, well, how is that possible? But when you go and you do iftar with in different houses, wherever, you will see that, mashallah, there's more food on that table or on that dastarkhan that we could have eaten in 2-3 days if it was outside of Ramadan. And it's the fried foods, etc. So let's be honest. It's about our conscious choices. It's what we want and how we think about things. And it also mentions about mindful eating slow, chewing our food properly. Sometimes we can eat, we're in a hurry, we're in fast, we eat so fast, the impact this has on our digestion, etc. And stop when we feel full, yeah? Sometimes we think, you know what, I'm full, but it tastes good. That was really nice, just go for a little bit more. No, it's about having that self-control, yeah? Because that little bit more, that is that bit that where it will get stored as excess, yeah? Avoid eating late. Nowadays, mashallah, it's become a habit. You sit back, you watch the series going on, and you snack. 11 o'clock, 12 o'clock, 1 o'clock, maybe. The impact that this is having on the body is huge. Yeah, eating late is a big thing. But it says also about mindful eating. When I was putting this presentation together, something came into my mind about even from my own family. I'll say it because it's very common. I've seen it with my own eyes with children nowadays, and if I've seen it with my eyes, it must be prevalent elsewhere as well. About children have the need to watch and eat. I don't know if there's a nodding in the head. Yeah, watching and eating. Yeah. What we're doing, we're putting something on for them to watch, and we're feeding them. Yeah, yeah. They're not thinking about what's going on. Yeah. 90%. Yeah, it happens. Yeah, and I'll be honest, it happens in my own house, right? I was reflecting on this and thinking, 1 minute, if we're teaching them this now, this watching and eating is going to become a habit, yeah? And even when they're older, they're going to have to watch and eat, yeah? And you're not thinking about what you're eating. You're consuming until you've not... We need to be mindful about what we're eating. We should have full attention on what we're eating. And reality is, obviously, we know the other harms. I'm not even going to go into that about what we're watching and what we're eating. But reality is that something I need to reflect on as well, and we all need to reflect on, is that because to break these habits are going to be very difficult later on. So when I thought about mindful eating, I don't know why my thought went onto this, but obviously I got a lot of nods in the room, so it must be a thing that's quite common. So physical activity. Now, obviously, it's a no-brainer. Physical activity is linked with weight loss. There's a direct correlation. Why? Because physical activity, moving, helps to burn calories. Yeah, it improves that metabolism. Yeah, we've all heard this word metabolism. Some people have a high metabolism, some people have a slow metabolism. If we want to promote our metabolism, we promote exercise. We promote moving. Now, also, we're going to talk about weight loss medication, and some of these people who take weight loss medication lose a lot of weight very rapidly. So again, we need exercise to keep those muscles strong and not lose too much muscle as well. So independent of the health benefits of losing weight, obviously improves blood sugar control, lowers blood pressure, boosts your mind and energy, improves sleep quality. All those things that we were talking about what obesity sort of plays against, yeah, all those concerns that it brings, exercise sort of improves and helps those things, right? So reality is counteracting. That's independent of the actual weight loss that you gain. So how much activity do we need to do? There's no hard and fast rule. There's no right and wrong answer. Everybody is an individual. It mentions here, this is like standard NHS guidance. Aim for 150 minutes per week of moderate exercise, can be broken into short sessions. But reality is, if you're not doing any exercise at the moment, if you try to do 150 minutes per week, you're going to really struggle. You might do it for 1 week and then you're going to be burnt out and your body's going to be aching and you think, oh, this is not for me. So reality is, this journey is different for all of us. We should all be doing some physical activity, yeah, because we want to be that healthy, stronger Muslim. But what that means for us is different. So if you're not doing anything, start with something, yeah. But whatever you choose to do it with consistency. So if you're not if you're not doing anything, simple things, walking to the masjid, yeah? MashaAllah, I came here, MashaAllah, it's my first time in this masjid, and I came and I was thinking, where should I park the car? Yeah, the parking is a thingy. So then I thought to myself, if I lived around here, I'd definitely be walking to the, but how many of us we might live 1 minute down the road, how many of us bring the car to the masjid, yeah? So it's just this, but reality is to walk to the masjid, even for myself, sacrificing that extra leaving from home 5 minutes earlier, reality is. So making these conscious things. So if you work in an office building, and we've got stairs and we've got lifts, we'll all be waiting. We'll wait 10 minutes for the lift, yeah? Reality is, if we take the stairs, at least we've done some physical activity for the day, because we will get to on top of the stairs, we're going to go sit in our office, on our desk, for 9 hours of the day anyway. So reality is that we move. But reality is, the more strenuous exercise we do, the more we build it up and we be consistent. Reality, to lose weight, we should be doing exercises that is increasing the heart. Yeah, we have a lot of female sisters and things that say, I do the house chores. I'm always busy. I'm always cooking and cleaning in the house. Reality, but reality for them, that's the norm, right? So if they're carrying excess weight and they just continue doing that, they're not going to lose weight. The reality is, they need to do something different that is going to increase their heart rate, whether that's 10 minutes, yeah, and then, but that change is what's going to cause the weight loss. But continuing, and inshallah, for us brothers who don't do much in the house, we'll inshallah, if we partake in the house chores as well, then inshallah there's a means of us doing some exercise as well, and doing some gardening and some household chores, inshallah. The main thing is, consistency matters most. Yeah, we choose something and we be consistent with it. So this leads us on nicely to weight loss medications. Like I mentioned, obviously this is a hot topic at the moment, so we thought we would allude to this, so people, you're hearing about it everywhere. I see in the news, BBC News articles, every month there's some sort of article about weight loss medications and stuff like that. Some people must be thinking, what is this? How does it work? Rather than and when you look online, wow, you get so many different things that come up, so many. The reality is that there's a lot of celebrities using medications and stuff like that, so you're getting a lot of misinformation. So inshallah, we can sort of reduce some sort of misconceptions. So reality is that when we utilize medication in weight loss, it's a tool, it's not a shortcut, it's not a cheat. Yeah. Reality is, when we look back at obesity, etc., we saw all those multiple factors of what causes weight gain and why people gain weight. So there are some people out there who have tried their hardest, yeah? They've done every diet that is possible, they do the exercise extras, but they just can't shift that weight. So sometimes we can utilize medication to get them on that journey and get them to be able to lose weight, so that they can continue with that as they go forward. So reality is that it supports weight loss alongside lifestyle changes. So you don't just take these basically you can't just take the medication and just sit back and relax and say, right, the weight is going to start falling off me. Yeah, it doesn't work like that. You utilize medication alongside the lifestyle. Yeah, they go hand in hand. So it mentions that it's not a replacement for healthy eating and physical activity, it goes in conjunction. So you may have heard of names like Mounjaro and Wegovy. Has anybody heard of these names? Yeah. So reality, these medications first came out as diabetes medications. Yeah. So they were diabetes medications, and when they gave these to patients, especially in the first clinical trials, etc., they realized that these patients are losing incredible amounts of weight. So they thought, oh wow, okay. So then what they did was they decided to test these medicines on patients who are clinically obese but don't have diabetes. And what did they found? In conjunction with good diet and lifestyle, they found that patients were able to lose approximately 15 to 20% of their weight. Yeah, that's why these medicines then went to get licenses for obesity without diabetes. Now, who is the medicine for? We would only give these medicines for these patients who have got a BMI of normally above 30, yeah, body mass index over 30, or if they've got a BMI of over 27 with other health conditions. So it might be diabetes, high blood pressure, it might be some sort of mobility issues, etc., where we think that there will be benefit for this person to be on this medication. But the key is that we should be encouraging good lifestyle, healthy diets, exercise, etc. You try this first. If then you can't, you've tried this and you can't, then we've got this option of the medication. I mentioned here as well that although they're for diabetes medicines, they help with lose weight. These medicines are now starting to, they've got lots of data now to see benefits for the heart, yeah? So they're finding benefits for reducing chances of having heart issues. They're also seeing benefits for kidneys as well. So reality is these medicines, we're going to see them more and more in our NHS practice as well for other indications as well, like we have seen recently with other diabetic medications. So how do they work? They work on a hormone called GLP-1. Yeah? So they're GLP-1 receptor agonists, meaning they work on this particular hormone called GLP-1. So what does this hormone do? So one of the first things that it does, it controls the speed at which our stomach empties. Yeah. So by increasing this hormone, yeah, we're slowing the emptying of our stomach. So food is in your stomach longer than usual. Now, obviously, it makes sense that if you've got food in your stomach longer than usual, you're going to feel fuller for longer. Yeah. These hormones called GLP-1, they also send signals to our brain. Right. So when we eat, these hormones are released in our stomach, and then these signals tell our brain whether we're full or whether we still got capacity to eat. Now, increasing this signaling will make us feel, will say to our body, no, we're full, I don't need to eat anymore. So it has a direct impact on our appetite. So we're eating less. And obviously it has, because these medicines are diabetes medicines as well, obviously it increases insulin and reduces glucose production and things like this as well. So reality is that we utilize these mechanism alongside. So reality, what we've seen is that slowing the having you feeling fuller for longer, reducing your appetite, etc. So a lot of people will come to me and say, my biggest downfall is snacking. You know, I eat such and such meal, but I snack a lot. So reality is that sometimes to eradicate that cravings, etc., you're reducing the appetite. So sometimes these medicines help to reduce those cravings, so you can come away from snacking, etc. Stick to your healthy diet, and that's how you see a lot of weight loss benefits. As mentioned, so approximately 15 to 20% of weight loss over time, but it has to be done in combination with diet and lifestyle, yeah, and exercise, etc. If you just take the medicine and do nothing, to be honest, you will lose weight, yeah, but you won't get that 15 to 20% weight loss. So what are the side effects? What's the safety of these medicines? Reality is that overall, people must be thinking, this medication, what's the safety implications, etc. Reality is that these medicines are highly used in our diabetic population. We prescribe it a lot for our diabetic. They've been tested on a lot of patients. So reality is they're a safe drug, they're authorized, etc. So in general, their safety profile is good.
Assalamu alaikum. We're just changing the batteries for the mics, inshallah. We'll restart in about 10 minutes. Need construction. So,
Jazakallah, we're back. So, we're talking about the side effects and the safety concerns with these medications. So, the most common side effect is nausea, diarrhea, constipation. Now, you think the way that the medicine works, just food is staying in your stomach longer than usual. So, when this happens, your body is thinking, wow, what's going on here? Why is this food there and it's not moving? So, reality is that this is the main reason why you get nausea, diarrhea, constipation. But it doesn't happen to everybody. Yeah, so some people will take the medication, not feel a thing. Some people will get it worse than others. But for most people, well, in general, the guidance is that it gets better with time. So as your body gets used to the medication, so the first 1 or 2 weeks, maybe a bit, you might have some nausea. By the 3rd to the 4th week, it should completely resolve. And then usually patients would increase the dose at the 1 month mark. So yes, you can expect nausea, but it gets better with time. Now, obviously, low blood sugar, or what we call the medical term is hypoglycemia. If you're diabetic and you're already taking other medicines like insulin or taking medicines like gliclazide, for example, then there will be a concern of hypoglycemia or low blood sugar. But if you're somebody who's not diabetic and just have no issues with diabetes and not taking any other medication, then this medicine will not cause low sugar levels. Even if you're, even though they're working on these medicines, it doesn't cause low blood sugars. Feeling tired. It mentions here about feeling tired. So if you lose a lot of weight quickly, you're losing a lot of nutrients. That is essential for our body. So initially, again, you would maybe feeling a little bit tired. Again, if your appetite is reducing and you're used to a certain level of food, for example, then again, but as your body gets used to this, and as long as you're eating small amounts of healthy food, nourishing food, then inshallah this side effect will not have a big impact. Mentions here about hair loss as well. Very infrequently, very uncommon, but I've seen some cases, mainly in females who have lost a lot of weight rapidly. We're talking maybe sometimes 10 to 15 kilos within 1 or 2 months. And what's happened is they've lost a lot of nutrients very quickly. Therefore, they've seen some side effects of hair loss. As the weight loss plateaus and you're not losing weight that rapidly, and I always encourage to take some good multivitamins when you're on this journey as well. So take vitamins, etc. That's good for hair growth, etc. to prevent this. But again, it's in a few cases, but I thought I'd mention it because some people have experienced it. Now, what's the main warnings and precautions? The main thing to patients who have had issues with their pancreas are not to take this medicine. Why? Because there is, again, very rare when they did the clinical trials, very few number, but it's in the literature that it has caused what you call acute pancreatitis, which causes inflammation of the pancreas. So anybody who's got this history, we wouldn't give them this drug. And if they did have this drug and they were feeling very sick, very unwell, vomiting and etc., they just know that something's not right, then they would report to get medical attention straight away. So also, if you currently have gallstones you can have the medicine, but once you've had the gallstones removed after roughly about 6 to 12 months, then you can be on take this medicine, but not because there has been a link to increasing chance of having prevalence of gallstones with this medicine. And likewise, for those patients who are diabetic, if they have issues with their eyes, diabetic, what we call retinopathy, then we wouldn't prescribe it for this individual. If they've had issues, in general, this medicine is quite good with liver and kidneys and things like that. But if they've got really severe impairment, then we wouldn't give it to this individual. But to be honest, I think if you had very severe kidney problems with your kidneys and your liver, then I don't think you really want to be at that stage of losing weight and things like that. But it's also mentioned, I mentioned here as well, especially for benefit of our sisters as well, that this medicine is not to be used in pregnancy. There's no data to show its safety in pregnancy. So if you were to take this medicine and you wanted to conceive, then you have to stop taking this medicine for at least 1 month before conceiving. Or if you did conceive whilst being on the medicine, then you would stop the medicine straight away. And likewise, there's no safety data in breastfeeding as well. So again, we would not advise to utilize this medicine whilst breastfeeding. So very briefly, practicalities of using the injections. So when you start to use the pen, we sort of show you how to. It's a medicine that you inject. Patients inject themselves. It's very simple. To be honest, I have a demonstration pen, but to be honest, it wouldn't be fair on the sisters if I start demonstrating it here. So reality is that what we tend to do as well. We give videos from the manufacturers to show exactly how to use the pen. It's very simple. You put the needle on. You don't have to calculate no doses. It's very simple, and you inject it. You inject it usually. It's normally injected in the stomach area or in your thighs, and again it's at 90 degrees. And you'll inject it, hold it there for a few seconds, and then take it off. It's a once weekly medication, so you use it once a month, and then usually it starts off on low doses, and every month you increase the dose, and every time you increase the dose in that increment gives you better possibilities of losing weight because there's more high concentration of the drug. So as your body gets used to it, you increase the strength, and then it gives you better chances of losing weight. So reality is what I tend to do is speak to the patient on a monthly basis, see how they're getting on. If everything's okay, then we'll increase the dose. Again, I'm not going to go into if you miss doses, we can advise what to do and how to take the medications. And because we're giving you this medicine, we're giving you the needles. When you get this medicine, you'll get like a Sharps bin as well. You can put your needles in the Sharps bin. For our family members we've got diabetics and stuff, we've seen that you put the insulin needles in there and they get you safely dispose of them. So how do you access these weight loss medications? So it can be done on the NHS in specialist weight management services. So this would be a referral from your GP, but usually only for patients who have got very severe obesity, who have got direct, their health is directly implicated by the obesity itself. So the category, the eligibility criteria is very small. So not many people will fit the criteria for this. But obviously, if you were to go through that method, then you get a good multidisciplinary support because you get the doctors, you get the dietitians, you get the psychology behind it and everything as well. So a very good package. But reality is, I think the waiting times in our area is something roughly, it must be like 2 years or something like that, just to access these services. So hence why there's such a big push in the private sector, because no matter how many patients we refer through the official forms, we have patients who have been waiting over 2 years for this to get it on the NHS. This is for obesity without diabetes. Obviously, this is a diabetes medicine, so if you're diabetic, you can readily access this medication from your GP, and there's no waiting. There's no wait. So just clarify that the waiting time is only for those people who are getting it for weight loss without diabetes. Then you can get it from a private clinic, private GP practice, etc. And these obviously more easily accessible. You book an appointment in the private clinic. It's assessed by a qualified professional. You get that. I think the key here with these kind of things is that support. The weight loss journey, and we've all been on this journey where if, for example, if we're trying to lose weight, it's not an easy thing to do. You need that sort of check-in, you need that support, etc. So a clinic, accessing this support from a private clinic, etc., gives you that personal touch. You're able to speak to somebody. You're supposed to be able to talk about lifestyle, etc., voice your concerns, and the treatment is tailored for you as an individual. The other option you've got is the online prescribing services. So you will see, it's very much in the media, there's a lot of push. So a lot of online services. There's an online pharmacy. You go on the website, you fill out a form. A pharmacist behind the scenes, you never speak to this individual, but they'll assess your form and they'll decide whether you're a suitable candidate, and then you pay for the medication and it gets posted to your door. Now, reality is as long as you're going to a regulated pharmacy, an approved individual, then the medication that you'll be getting through the door is official, etc. It'll all be safe, and they have their processes to make sure that they're prescribing to you in a safe manner. The only drawback to this kind of service, obviously, it doesn't have that personal touch. What happens when something goes wrong? And I've noticed a lot of people, what they do is because it's not professionally guided, they start switching and changing doses and start doing. I've seen some weird and wonderful combinations and ideas of how they're going to do this, yeah, when they go through this method. So if you're going to do this method, then I would strongly advise, number one, you make sure that your provider is a regulated, proper pharmacy, and there's some sort of support. And you know yourself, you're quite well with and have a good understanding of what this entails. But in general, should do it under the guide. In general, if you best to do it under the guidance of a clinician. So the options to avoid: social media. You'll be surprised what's out there at the moment. There's a lot of this on the black market. Social media. I've heard people saying that I went to my beauty salon and the beautician was selling some weight loss medication. I was thinking to myself, I would hate to know what is inside that drug, because clearly they've not got a licensed medication or whatever. They're getting something off the black market. People are injecting, and we've heard some horror stories of people injecting themselves and ending up in hospital because of the adverse reaction of this. So please make sure that whatever you do is done in a safe manner, and healthcare and guided in the right manner. So this is the final slide. So how do we support each other as a Muslim community? Yeah, because we've mentioned that obesity there's no judgment in this. There's multiple factors of what might be causing this. We as a community are definitely affected. Yeah, the rates are increasing. So what can we do as a community to support this? So number one, we create a supportive environment. Number one, we don't be judgmental. Yeah, we don't be. We have those stereotypical thoughts, because now we understand that there's multiple factors what might be causing this. We encourage healthy choices, yeah. We share positive messages about health and well-being. So, alhamdulillah, this is a really good initiative that's been started over here about promoting health, etc. We need to do more of this in our communities, because reality is that the more we speak about it, inshallah, the more lives we can affect. We use the mosque as a health hub, yeah. So we can potentially have walking groups after salah. We can have like brothers walking groups, sisters walking groups. We can have I've been to some masjids, mashallah, like on a Sunday morning, the imam sahab and the thing is they'll go for a run, yeah, or they have a cycling club, or they have this club, yeah. So if our youth and us, forget our youth, even us, wherever, we want to be healthy, we want to do stuff, why not facilitate it here? Why do we have to go to different places and thinking we should be facilitating from the masjid as well, and promoting this health. Healthy food options at mosque events. I found this a bit funny. This will be a good test. Huh? Well, inshallah, I'll come for iftar in Ramadan to see what's on the thingy spread. But think about this: that what we are all leaders here. Yeah, and what we're putting down is sending a message. Yeah. What are we putting in front of our youth, in front of everybody, is having a message about what. So if we want to promote health, let's lead it by example and show beautiful, nice tasting food, but that's also healthy as well. Supporting healthy eating at home, yeah, cooking balanced meals for families. I think this is really important. We should all go back and reflect on what's happening in our own houses, yeah, in our family members, and what message what we're doing for ourselves and for our family members, and how we're promoting healthy. It mentions here about sharing healthy recipes within the community. Mashallah, I know that this masjid is very active in terms of supporting things for the sisters, etc. There's no hiding behind it, that obviously a lot of our sisters' time, etc., at home goes into cooking, etc. And in reality, this is a passion for majority. So why not have some circles where we can share healthy recipes, cooking lessons, or whatever it might be, and especially for our younger generation of sisters as well that are going to be growing and getting married and thingy. Reality is that our mothers, mashallah, are fantastic in the kitchen, etc., and doing beautiful things. It's just going to be is this knowledge going to get passed on, etc. So we should be thinking how we can be healthy. Otherwise, what we're going to do will be resorting to the fast food, etc. because we have no other option. Yeah? I've already mentioned about walking groups, etc. And obviously, we need to support mental and spiritual well-being. We want to be the best Muslims we can, highest in Iman, increasing in our ibadah, etc. If we are not healthy, then we are not able to do this. So we encourage as a community that we remind each other to be reduce our stress through prayer and reflection, encourage seeking help. This is something we don't do as well as a community. That, okay, for example, how many of us would be comfortable to seek help from our brothers in our masjid if we have a particular. So, for example, if we were a brother who had difficulty with obesity, reality is a very difficult topic. That individual would find it difficult, but this should be a safe zone, that comforting place where we can reach out to somebody. In this own community, there will be other people who work in this sector, etc., that we can provide support. So, inshallah, we can do more of this, inshallah. So, and that's the end of the presentation. So, Jazakallah. Sorry, I've probably gone over time, but inshallah, we're ready for. Happy to take any questions, inshallah.
Jazakallah khair. MashaAllah, amazing talk. MashaAllah, it's very holistic and so many avenues covered. I just want to say that there is a representative on the sister side, so the sisters can let them know. And they can WhatsApp the question, and inshallah we can address them. There's also, if people wanted to write questions down rather than speak them, rather than say them out, there's paper and pen on a chair at the back. So if people want to write questions, they can do that as well. I'll hand them. Okay.
So the question was from the brother was that obviously we're seeing a growing trend from our youth to resort to fast food, etc. So how do we encourage our youth to come away from this? I think reality is the question lies with us. We have to reflect on ourselves as role models. Yeah? That we are we are all, for example, brothers, fathers in our house, etc. We are role models, so let's reflect on ourselves and how we are portraying ourselves in the thing. If we show, and that's why it was mentioned about what we do in the masjid as well, and how we make these healthy choices and show what is healthy, then and come away. So we speak to our youth as well about the concerns with. There's multiple different concerns with. Resorting to so many fast foods and things and the health implications that might be. So I think we have to, as a community, we have to be role models and sort of lead by example. So, for example, if I would say in my own family, for example, that we may be, how can I say? I don't know if it's common practice in your family, for example, to eat takeaway, for example, get takeaway once or twice a week, etc. That we say to ourselves, to our kids, no, look, we're going to make it every 2 weeks now, inshallah. Yeah, why? And we explain to them the reasons behind this so they understand. Yeah, it's not because it costs too much. Yeah, because that is an implication as well. Our youth should understand about cost implications, etc. But what is the health benefits of this? And we look at our youth as well in our own family. If, for example, they are carrying excess weight, we know that they're going to struggle later in life as well. So being able to explain to them that, you're carrying this excess weight in your youth, the implications that's going to have later on as well. So reality is there's probably not a great answer, but there's no right or wrong answer. But I would say my answer would be to lead as an example. There's some
questions from the sisters. So the first question is, are the weight loss injections easily available? So I think this wanting some more clarification about how they can access their weight loss injections.
Okay. So there was a question from the sisters about how to access the weight loss medications. So if you, there's two main avenues, like it was mentioned. The number one is from a private GP practice. So from a private GP practice that does weight loss clinics, that will be clinician led, and obviously that gives you the guidance and the support and on a monthly basis, etc. The other option is obviously like it's mentioned about the online services, which makes it readily available. You can go online, put the form in, etc. But if you have apprehension about this, or if you've got questions, then I would suggest that you go down the route of accessing it with a clinician where you can actually speak to somebody, because that will probably we can get a lot of your questions answered. But if you do go down there are multiple providers, but make sure whichever provider that you choose from, when you go, I'm thinking these names like MedExpress or Bolt Pharmacy, etc. That all these pharmacies that are there, they're reputable. They deliver the correct medications to your door, etc. And they're easily accessible. So there's that option, but there's also the option of doing it with a private GP practice or pharmacist. Yes, as well. So even your local community pharmacy now is also providing. So you can go in and they do the prescriptions through a different system. So you can collect it speak to your local pharmacist, and they can also do it that way as well.
From your experience, which one do you recommend, Mounjaro or Wegovy?
The question was, which one do you recommend, Mounjaro or Wegovy? So in general, most people take Mounjaro because when the clinical trials, it showed that that had the greatest effect on weight loss. Okay, so in general, it helps to lose weight more quickly. So people want quick gains, yeah? So we're in a society of quick gains, right? So a lot of people go for Mounjaro in that sense because it's got the greater potential for weight loss. But on the other hand, Wegovy has got other proven benefits, proven for it to be protection of the heart. It's got cardiovascular benefits for protection of the heart. It's also got it's starting to get renal, kidney benefits, and also price also comes into a factor. If you're buying this privately, then Mounjaro is in general more expensive than Wegovy. So if budget is an issue and price is an issue, then Wegovy would be the cheaper option out of the two.
Can you give some information on the pricing benefit for the company?
Yeah. So in privately, in general, the prices of Mounjaro would start from approximately around about 200 to just less than short of £200, going up to the highest strengths. So you start off at 2.5, you go to 5 milligram, etc. The higher, as the pens increase in strength, they increase in price. So it can go up to 300 plus. So the starting is around about 200. With Wegovy, it starts, you could say roughly just less than 200. Maybe 180, etc., and it goes up to a maximum of about 250. And that's per month. Those costings are per month. You get one pen for that price for 1 month. Yeah, you get 4 doses in one pen, and then obviously you pay on a monthly basis. So yes, it is. These kind of prices are expensive. There's no doubt about it. But reality is that. They have proven to a lot of people, and you'd be surprised. I'd be surprised at how many people actually access these medicines. People you would think that would be financially not able to, but because they're seeing benefits of it, they are utilizing it as well. So it's surprising how many people are actually accessing these medicines with these prices. Yeah, so when you get to, you'll probably slowly increase increments. So what you would do is tell it, so you know where you want to be. What's your target weight? So as you increase the dose, you will get to, you'll see that you've lost the weight that you want to lose. In general, I don't tend to get people onto the highest doses, because obviously the more higher doses you have, the more chances you have of side effects, etc. So we tailor it for that individual. And then when you get to your chosen weight, you're comfortable, you would stop, you might stay on the medication a little bit, and then you start wean off the medication. Now what's key here is When you start to come off the medication, if you have not made the lifestyle changes, if you have not, in that journey, if you've not made those changes to your diet, to your lifestyle, to your exercise, the chances are if you do nothing and you just stop the medication, that weight will come back on. It's inevitable. Yeah. So the purpose is that's why it was mentioned, stressed. This is in combination with diet and lifestyle. If you're going to use this option, make sure you make changes to your diet so that when you come off it, you have sustained weight loss.
No, I was just going to say that if you come off it, the weight starts to come back.
Yeah.
But the other thing is that through the tiered weight management service, isn't it 2 years that you can understand 2 years?
On the NHS weight management program, I'm not too sure. The brother asked is there a limit on the time that you can stay on these medicines? Yeah, it's 2 years. But reality is that with these medicines, because they are bringing, now they've got data for cardiovascular benefits, etc., I think this will start changing as well, because they're going to be start thinking, well, if it's protecting your heart, if you want to stay on a low dose, you can do things like that.
The obesity threshold is less for South Asians.
Yeah. The one that I've quoted is the lower threshold. Yeah.
I guess another question from the sisters. Sisters asking that after stopping the injections, if you maintain a healthy diet, will you still put weight back on? If you're maintaining a healthy diet after you stop injections, will you still put weight back on?
No, if you're maintaining a healthy diet and if you're maintaining a healthy diet and you've reduced from what you started from, then you've got greater chance of. Don't get me wrong, the appetite suppression that these medicines give you are quite substantial. So when you start coming off, that's why it's important to wean off it slowly, so you can start to manage the appetite and make sure you're controlling your diet. But I have seen many people who've come off it, maintained a very good, healthy lifestyle, and then maintain that thing. So it takes a lot of effort and sacrifice from yourself. But as long as you maintain that good diet and exercise and lifestyle, then inshallah you will be able to keep the weight off.
Did you, Dr. Oka?
No, you've answered the question.
So just a question from the sisters. There was, I think, wanting some more reassurance about how common the side effects are, particularly hair loss, other side effects. How are they pretty rare?
Yeah, so the hair loss side effect is very rare. I would say the only time you're going to get the hair loss is if you lose a lot of weight in a short period of time. Yeah. So if in the first couple of months you lose a lot of weight, which is sometimes possible, I've only seen, out of all the cases that I've dealt with, I've only had a couple. I would say two individuals who are female who had weight loss in it, and I've treated a lot of patients and supported a lot of patients in this. So it's rare, but I thought I'd mention it because when it does happen, it can be quite distressing. So again, having good nutrients and having multivitamins, I would recommend. In terms of the rest of the side effects, the most common side effect mentioned about nausea, etc., that gets better with time. You should within a few weeks, you should feel that that's passed. So there is an element of perseverance.
Sorry, my question is, when will you come again, inshallah, for a prophetic eating session?
Sorry?
When will you come again for a prophetic eating session?
A prophetic. I feel that that's out of my. Inshallah, we should find an alim who will do it. But inshallah, we'll do it as a combination. The brother asked when we're going to do a session on prophetic eating. I'd love to be involved. To be honest, it was a learning curve for myself when I was putting this presentation together. I asked a few of our scholars, etc., to support me and help me. So inshallah, we'll do a session on this, and we'll get a scholar in as well who can give us the background. We can link the prophetic eating as well as the health benefits of that and what that means for us as an individual.
Yeah, I'm just saying, obviously in relation to the injection, obviously it's a common trend now over the last 12 months or so. Getting a lot of people saying, well, it's not a medical, but obviously it's a case of taking the injection, but changing your lifestyle, diet, exercising. It's not a medical injection, but you're going to weight loss here and then you're going to continue with that. It's a procedure that you're going to continue to
Yeah.
follow up,
So
follow through.
yeah, so
You're going to lose weight and then, that's it.
the brother is mentioning that. Yeah. So the the brother has mentioned that it's not a miracle drug. Yeah. Yeah, like I've mentioned before as well, that you have to do the lifestyle changes alongside it, inshallah. So there's no more questions. I also mentioned that I will leave my details with Dr. Nasir Mirza and the management committee as well. If there's any, I'm happy to support individuals in the community, brothers, sisters, etc. So if there's any other further queries, concerns, support required, etc., I'll leave my details as well, my contact details. So I'm happy to support the community where it's required, inshallah.
One of the last two questions. One is obviously, does the hereditary play a part in it? You know, like you've got genetics, you've got long, ongoing, and then you take the injections.
So the bit that you missed at the beginning, it's in the recording, inshallah. So inshallah you could go back and listen to it. So genetics is a big part of it, inshallah. But because of time, inshallah, we'll think that we can catch up.
Before I go, is it buy one, get one free?
Jazakallah khair again to Brother Junaid. Excellent talk. Jazakallah khair for taking the time out today and for taking the time to prepare this presentation. And we will be sharing the feedback, a link on the WhatsApp group. If you're not part of the WhatsApp group, please scan the QR code to join the WhatsApp group. The feedback is really important for the speaker, for the masjid. So please do share your feedback. Jazakallah khair once again, Brother Junaid.